Welcome to the lecture series on vitamins and nutrition. So today, as a continuation from the previous session, we are going to look at osteoporosis as a symptom connected with vitamin D deficiencies. Now in the previous sessions, we were looking into the details of vitamin D metabolism, their deficiency diseases, especially among children, rickets, and we started with osteoporosis as a symptom connected with adults. Now in this session we are going to look at in detail about osteoporosis, because it's one of the major symptoms connected with vitamin D deficiency in adults. So we might think, yes, it is true, as far as children are concerned, you have to have proper dietary supplement and provide them with vitamin D very early, and especially deficiency in the premature state can give rise to lots of complications, and we saw in the previous session how these complications can really be sometimes have a long term disability factor in the life of children as they develop and grow into adulthood. But now, having crossed a healthy childhood, healthy adolescent phase, and being adults or probably even adolescents entering adulthood, if at all people could suffer from vitamin D deficiency, what are the complications that can result? This session is basically focusing more on osteoporosis connected with adults. So you look here, the osteoporosis connected with adults, you find lots of changes happening over there in the bones. So you see there the classical signs and symptoms of osteoporosis in adults. So this can be revealed by X-ray pictures. So you see there is a decrease in bone density. So you see over there the bone density becomes like almost hollow, and then wedging or biconcave vertebrae. So what do you mean by wedging or biconcave vertebrae? So you see there the vertebrae gets kind of a concave appearance. It's like kind of a cut across. Then you have a thin cortex and deformities. So you could consider this could result in prolapsed disc vertebrae related complications. So a biconcave vertebrae can cause severe inflammation, and all the nerve bundles which actually get supplied across this biconcave vertebrae can actually create a bulging neuralgia conditions. So when you say neuralgia, it's pain in the nerves. So look over here, how do we treat this? So we have to know the underlying cause, whether it should be, so we have to do differential diagnosis. So we should know whether it's an arthritic condition proper, or it's a condition resulting from vitamin D deficiency associated hypocalcemia, eventually resulting in arthritic complication. So you see idiopathic. So what do you mean by idiopathic? So idiopathic means you are not able to like really ascertain what exactly had been the reason or the cause behind this condition. So idiopathic is unknown condition. So then you know, yes, definitely it's a calcium and vitamin D deficiency. Then you also have problems connected with fluoride and triple therapy. Okay. Then you have other hormonal complications coming up, calcitonin, diphosphonate, and probably it can also result from what do you say, treated fractures which have actually resulted in inappropriate healing process, giving rise to osteoporosis like condition. So our concern for our discussion would be calcium and vitamin D deficiency, because osteoporosis is a terminology, as I've been telling you earlier. I gave example on jaundice and I gave example on vitamin D deficiency, even as I told in rickets, I said rickets can be a condition which can result independent of vitamin D as well. So we should know exactly this should be associated with vitamin D. See, we use this terminology osteoporosis, osteomalacia and rickets very frequently associating with vitamin D. It doesn't mean that you have conditions only with vitamin D, although 80 to 90% of the cases are always associated with vitamin D. There are other pathological conditions associated which we should be really familiar. So how we can prevent osteoporosis? So compared to the previous session, you see over here the calcium and vitamin D. So this is the major point what we are trying to emphasize. So calcium and vitamin D deficiency giving rise to osteoporotic conditions. So look here, we can have good diet and adequate exposure to sunlight, then you have adequate intake of vitamin D and calcium, and then obviously you also need to have hormonal therapy. Suppose if the hormone secretion, parathormone and calcitonin and all those hormones associated with calcium metabolism, if they are irregular or deficit, then accordingly it needs to be supplemented. Now we are going to look at vitamin D deficiencies with individual vital organs and underlying diseases. This is going to be of much interest because we might be studying vitamin D as a nutrition supplement, and we have been looking at how vitamin D can be added as part of dietary sources, but here we see how vitamin D can actually have an impact on individual vital organs. So look over here, we have the low levels of vitamin D associated with cardiac conditions. So you have, whenever there is a low level of vitamin D, people have done, I mean lot of correlational studies have been done. So they associate vitamin intake and vitamin increase in the elevation or decrease in vitamin D connected with, I would say, cardiac conditions. So you see there are more increased cardiovascular complications and mortality. So one study says that whenever there is vitamin D deficiency, you do have 45% risk for coronary artery diseases. So what is this coronary artery disease? So you should be aware of it. So it's a condition where the coronary vessels, see, heart being a pumping organ still needs to get blood for its own pumping. So these two blood vessels, branches of blood vessels, which actually supply heart as a branch from aorta. Aorta is a branch, major branch, trunk that takes blood from heart to other parts of the body. So aorta branches down and gives rise to two sub branches, what you call them as like coronary vessels. If there is any problem in the coronary vessel, okay, there could be a whole range of problems associated with coronary artery disease. That's why we categorize them as coronary artery diseases. There could be complications independent of vitamin D. So what we are looking in this session is how vitamin D can be associated with coronary artery disease. So people have done a correlation study. So they have checked up vitamin D deficiency over a period of time, and they have looked into the severity of coronary disease that they can develop. So they found almost 45% correlation. Maybe I would say coronary vessel defect could arise because of angina. There is a spontaneous closure of smooth muscles which supply the coronary artery disease. Now vitamin D deficiency associated with hypocalcemia could increase the frequency of such kind of anginal closure, or the elasticity of vessels might be affected because of calcium deficiency associated with vitamin D. So this kind of close correlation can give rise to worsening of coronary artery diseases. Then comes this condition called stroke. So in case with stroke, so technically stroke is called cerebrovascular accident. So what is exactly stroke? So as coronary artery disease is associated with blood, so what will happen if heart is not supplied with sufficient blood? Heart will not have oxygen to pump. So this is associated with calcium involved in musculature. Similarly in the brain, if vital blood vessels which supply different parts of the brain, all of a sudden, if there is a sudden occlusion, or it could be a sudden cleavage, I would say block, I would say there could be something like there is a degenerative changes in the vessels which supply the brain. So the degenerative changes can be also due to hemorrhage, but the one which we are looking over here, stroke, is more to do with embolic version of stroke, occlusion related stroke. So in such cases you could always associate vitamin D deficiency concerned with hypocalcemia giving rise to stroke. So you see, people who take vitamin D regularly can actually safeguard themselves from stroke related complications. And let's say some people already have a family history or probably complications connected with stroke. If you supplement them with vitamin D, then that could really make their conditions in a upper level of preventing or securing them against the complications associated with stroke. So you see over there again coronary attack connected with heart attack. So heart attack is technically called myocardial infarction. Suddenly the myocardial muscles cease to function. So almost 50% complications connected with heart attack, myocardial infarction, can be prevented by taking vitamin D. And then you have other diseases almost in the range of 25 to 50% covering with deficiency diseases. So you see vitamin D is very much associated with all these vascular complications connected with vital organs, heart and brain. Now other critical illnesses. So if you look at other critical illnesses, there could be multiple organ failure, then the length of stay and the infection. So overall, if a person is in ambulatory care, so means what? The person is hospitalized and needs constant medical supervision, you supplement them with vitamin D. It actually helps their condition, helps in the healing process by bringing down inflammation. Now there is one more association, what we call it like multiple sclerosis. So what is this disease called multiple sclerosis? So multiple sclerosis is basically a degenerative change of motor neurons in the brain. So multiple sclerosis can give rise to, suppose let's say you have to do complicated motor functions, so associated with, I would say, skeletal muscles. So in multiple sclerosis, the nerves which basically supply the complex process gets or undergoes degenerative changes, and vitamin D has a very close association with such kind of conditions. So they say even levels of 40 nanogram higher, I would say 40 nanograms per ml, if you are going to have an elevated amount of vitamin D, it actually helps us in preventing multiple sclerosis. So it becomes like really mandatory. So what we are up to? So vitamin D supplements not only in the form of food, but it's always advisable that we take vitamin D on a prolonged course, and that would actually have a whole range of protective function it could offer, right from heart to multiple sclerosis and degenerative diseases. Better, let's say you look into the case study or medical history of an individual and you see a family line of multiple sclerosis, or I would say biomarkers that would lineate them to multiple sclerosis kind of conditions, would definitely create, I would say, a better perspective of involving the person into more risk for multiple sclerosis can be averted by use of vitamin D supplements. Not only that, if patients take other mineral supplements which would be dealt in different sessions, you see like magnesium, calcium and 5000 units of vitamin D over a period of time also reduced exacerbations. So what do you mean by that? Not only it's in a prophylactic state, but people who are already into multiple sclerosis conditions. So exacerbations means what? Getting more complications, getting into more violent related I would say degenerative changes. In other words, if you want to like keep a person in a prolonged state without developing more complications of multiple sclerosis, you put them on an additional supplement of vitamin D. They say additional supplement of vitamin D really helps these conditions. So it will be always good when we regularly take or make sure we take adequate quantities of vitamin D, and we never run in short supply of vitamin D. You could prevent all these conditions, and for patients who are already into such complications, as in this case with multiple sclerosis, giving them vitamin D would really help in improving the case. So you see over here vitamin D and cancer, there is a close association. This is very interesting because cancer is a disease which I would consider to be a kind of a systemic condition. Every cell in our body needs a close cellular monitoring, and every cell has this option of programmed cell death. So every cell will go into a phase of senile state. It means what? It would age, and the cells are so programmed, and the moment they reach this senile state where their function gets affected and they know for sure their contribution as a cell in the overall function gets depleted, they start going into a change where they would now give way for new cells. So all the essential components of this cell would be like redistributed, and the cell will silently undergo a kind of a death, what we call it like apoptotic death, which is a favorable death. But for some reason, if cells stop this process of apoptosis and revert back, where they lose differentiation and eventually get into a state of uncontrolled proliferation. So it means they literally go immortal. Okay, it's okay if they go immortal as long as they do their function, but in case with cancer, it's a different story. So in cancer, what happens, especially cancers associated with cellular attrition and cellular inflammatory process, differentiation loss would be heavy, and they become very aggressive. They go into a malignant phase where they not only become or drive themselves to a state of immortality, but also seize all the essential nutrients from the neighboring cells and try to completely, what do you say, arrest progress to the neighboring cells and spread this kind of abnormality or inherited changes to the neighboring cells, making that spread of cancer very fulminant. So you see over there is an inverse correlation between incidence, mortality and survival rates for many cancers, including, I would say, breast cancers, colorectal cancers. So people are now trying to look at, so this is something very interesting to notice. You see inverse correlation. So means what? Vitamin D sensitive tumors. So you see 1000 units can reduce cancers in the 7% and 9% of women. So you see over there you have reduced mammillary carcinoma whenever they are supplemented with, I would say, higher doses of 25 hydroxy vitamin D. So when you increase the level from 29 to 39, we reduce the cancer risk from 60% after 4 years. So all those people who are in the remission, okay, who are in the therapy, have to take vitamin D as a supplement to have better outcome of the therapy. So that's the summary of all these studies. So these studies suggest that a daily intake of vitamin is essential, and we need to maintain a serum level of approximately, you say, 50 nanogram and above to really have a good beneficial effect for vitamin D. Now we are looking at making an association of vitamin D with lungs. So you see in the lower respiratory tract infections, you have more probability of people getting infection, okay, especially respiratory conditions. So you see, taking sufficient amount of vitamin D increases dramatically the immune response, and thereby could even make people have tolerance and fight back viral diseases like influenza. See, for people who suffer from influenza, and I would call it like seasonal influenza, means what? Although it's not rampant in India, but in certain developed countries, seasonal influenza is a big issue, and their immune system should respond promptly by mounting sufficient amount of antibodies and also preventing greater exacerbations. Now supplementing people with 2000 international units, see, this is a point to note. Not only vitamin D, vitamin C also helps. So vitamin D's contribution is also there. That's a point what I'm trying to emphasize. So if you're going to supplement with vitamin D along with vitamin C, although I have not mentioned here, so it offers a greater protection of immune response. So you see there, in this case, vitamin D, what exactly the role of vitamin D would be here? So we find vitamin D reduces inflammation and viral pathogens. So this is of much interest because vitamin D has a tremendous implication. So it tries to bring down inflammation and viral entry. So this would offer huge advantage in immunotherapy and in preventing allergies and in boosting immune responses. So we could like summarize and say vitamin D and vitamin C can actually help in promoting respiratory tract health and preventing inflammation and enhancing immunoprotection against viral pathogens. Now you look over here, certain supportive data, some of the clinical trials and close monitoring studies have been conducted. So you see there versus placebo, they have given a dummy medication and compared it. So you see for flu almost like 80%, and for asthma you find the risk of asthma being brought down drastically. So we could simply say supplementing with cod liver oil, the capsules, regularly, maybe for children, you could have a very good improvement in their response to influenza and also response to allergy. So low vitamin D adults are at double risk of viral infection. So it's always good we take vitamin D on a regular basis, vitamin D and vitamin A, and we are going to look at vitamin C shortly in the coming sessions. So right now the trend goes like this. So vitamin D is such an essential vitamin, and it plays a very good role in also boosting immune responses. So far what we have been looking at is the normal metabolic functions have been interfered, okay, and that results in rickets, osteomalacia and osteoporosis. But now we are looking in the other side, the positivity of vitamin D, how vitamin D enhances health. So this is something of a total new dimension. Our nutrition supplement should really help. So one more component that would also interest the learners would be vitamin D and dementia, because right now if you look at dementia, that's becoming a big mess, and people suffer from Alzheimer's and all the neurodegenerative diseases. So you see there, dementia is loss of memory, loss of mental processing, loss of ability connected with acuteness in thinking. So in total we could always consider the cognitive functions are getting diminished. So you see there are different aspects of dementia. So the executive cognitive functions, and the negative tone of it is people's inability to cope up with depression and stress. So that can give rise to full blown disorders like schizophrenia, bipolar disorders. This is the other end. The other end is connected with the efficiency of mental processing. So you see there, vitamin D supplements, low vitamin D supplements create cognitive impairment. So means what? For people who are in cognitive related professions or skills, and for children and adolescents who are in the stages still in university or colleges or in the schools, need to have sufficient amount of vitamin D. And recently they have also reported vitamin D receptors in the brain. So increased vitamin D can improve cognitive functions, and for people who have been diagnosed with Alzheimer's disease, taking vitamin D would really help in modifying the outcome of therapy, or at least for people who have had biomarker validation of Alzheimer's disease, taking vitamin D would delay the onset of disease. Now yes, this is also a very interesting topic. Two more to go, vitamin D related with obesity and vitamin D connected with diabetes. So you see there is all this obesity, propensity for people to accumulate more fat related adipose tissues in their body, and this gives rise to lots of metabolic problems. So you see vitamin D deficiency can actually make a person prone for obesity. So if you could take sufficient vitamin D, you could have a control on obesity. Diabetes, as I've told you earlier in the early sessions of the slides, we have seen how this plays an essential role. See, for example, lack of vitamin D directly plays a role in insulin insensitivity. So for people who are diabetic, should definitely take vitamin D supplements, otherwise their insulin sensitivity would go from bad to worse. So in spite of all therapy, that's how recently most of the diabetologists, in addition to the mainline diabetic therapy and exercise and other recommendations, they also put these patients on nutritive supplements, especially B vitamins, B12 and vitamin D. So this exactly helps them. See, this has a very close association, because alpha lipoleic acid and essential fatty acids have a role to play. So since vitamin D is also a cholesterol based molecule, I'm not trying to say that this could be a very good source, a precursor for a variety of other components which are being synthesized and being utilized, and acts like a kind of a counter inflammatory process. So you see over there, depression. So they say you can have a seasonal affective disorder, I would say like mood swings. So people have done vitamin supplements for people who suffer from mood swings, and they have found an effective measure or an effective correlation that there is a very good improvement in the outcome of the disease. And then you do have other conditions. What we have, the genes which control vitamin D. So there are many genes which are under the regulation of vitamin D, because if you remember in the early session I explained about how vitamin D acting on the nuclear receptors in the cells. So you see over there, they upregulate variety of genes as a protective measure, upregulate those genes which are which could activate apoptotic pathways in cancer cells and help those cells which are already in the senile state to go away. Then we have seen already the immune function being controlled. So the question was how vitamin D is able to do all this, because vitamin D primarily has nuclear receptors, and through the nuclear receptors which are in direct control with cell regulatory mechanism, it's able to do this. Okay, here we have vitamin D supplements. So this has been realized very early. You see over there, people are being exposed to sunlight to have vitamin D activation in their skin, and then you have cod liver oil being marketed very early, and children are being given compulsory vitamin D supplementation in schools. So where especially in European setup where their exposure to sun is very less. So I have known cases where people especially in Europe and in the upper northern part of the equator, where in the cold countries, as you call it, the belt, as you go up further in the north, people suffer from severe skin diseases and vitamin D deficiency on a chronic basis. So very early we need to supplement with more amount of vitamin D to counteract all these side effects. So here is a recommendation also given by American Pediatric Society. So they say like you have to have a minimum of 200, 400, 600 or 1000 international units depending on the kind of condition or the age to have a prophylactic dose to prevent all the complications associated. The best supplement would be cod liver oil preparations, and here we have a daily regulation of what all doses that's always needed. So this is the regime, the target, the weekly targets, and the maintenance therapy. So you see over there is a chart which gives you how much amount of vitamin D that needs to be taken. Okay, so to treat not only deficiency conditions but also on a maintenance therapy. So you see over there, for people who already have these conditions, we have to rule out endocrinopathy, hormonal conditions, and for especially women who report conditions of amenorrhea, absence of menses and other complications, and correlating with BMD, bone mineral density functions, there could be a strong correlation with vitamin D deficiency. So adequate intake of calcium and vitamin D could actually be a reason behind all these complications. So we are coming to the end of the session, so it's going to be a quick recap. We have dealt elaborately on the adult symptoms concerned with osteoporosis, and we have done a very good correlation between vitamin D, diabetes, vitamin D, neuronal function, vitamin D with heart diseases, and vitamin D with immune functions, and we see variety of diseases and systemic illnesses and degenerative changes can actually be treated and maintained and prevented from exacerbation with vitamin D supplements. I hope this session was very useful. In the coming sessions we would carry over with more study on the remaining vitamins, fat soluble vitamins and water soluble vitamins.